Have you ever felt an overwhelming, crushing fatigue that doesn't go away despite getting enough sleep, or experienced strange tingling sensations in your hands and feet for no apparent reason? These symptoms could reveal a vitamin B12 deficiency that silently affects millions of people worldwide, and what you're about to discover might completely change how you view your health. The vitamin B12 is an absolutely essential nutrient crucial for DNA synthesis, energy production, and proper functioning of the central nervous system. Although this vitamin is present in many foods, insufficiency and deficiency in vitamin B12 are surprisingly common in the general population. This concerning situation is often due to limited dietary intake, malabsorption problems, certain specific medical conditions, or the use of medications that deplete B12 reserves in the body. The ability to absorb vitamin B12 from foods naturally decreases with age, which explains why deficiency is more frequent among older adults. However, it is also widespread during pregnancy and can affect young adults and even children. Contrary to popular belief, this deficiency doesn't discriminate and can impact anyone regardless of their lifestyle. If you find these health insights valuable and want to continue receiving educational content like this, take a moment to subscribe and activate the notification bell right now, because your support gives strength to this channel. And don't forget to check the link in the description for exclusive giveaways and contests that could benefit your wellness journey. Where are you watching this video from today? Share it in the comments below, because we love connecting with our global community. In this comprehensive video, we will explore in detail the most common signs and symptoms of vitamin B12 deficiency that you absolutely must know to preserve your health. Weakness, fatigue, and dizziness are often the first warning signals of vitamin B12 deficiency that patients report to their doctors. Our cells need B12 to function properly, and when this vitamin becomes lacking, our body begins to show signs of distress. A deficiency in B12 or folate can cause megaloblastic anemia, a condition characterized by the formation of abnormally large and immature red blood cells. This abnormality is accompanied by an alteration in DNA synthesis that disrupts cellular functioning at all levels of the organism. When the body doesn't have enough healthy red blood cells to carry oxygen to tissues, a persistent sensation of weakness and fatigue gradually sets in. It's important to note that these generalized symptoms can be caused by many other reasons, which sometimes complicates the precise diagnosis of the deficiency. A more specific sign is the appearance of a red, painful, and inflamed tongue, a medical condition called Hunter's glossitis or atrophic glossitis. This oral manifestation can constitute an early sign of vitamin B12 deficiency that health professionals look for during clinical examinations. During a thorough oral examination, one can also observe stomatitis, xerostomia or dry mouth, chylosis, and bleeding gums that complete the clinical picture. It should be remembered that glossitis can also be caused by deficiencies in other nutrients like folate, riboflavin, and niacin, requiring a complete nutritional evaluation. Paresthesias in hands and feet constitute another frequent and particularly worrying neurological symptom of B12 deficiency. The medical term paresthesia refers to a burning or tingling sensation similar to needles in certain areas of the body, mainly the extremities. Many adults and children suffering from vitamin B12 deficiency report feeling these unpleasant sensations that can considerably affect their daily quality of life. Unfortunately, this B12 deficiency symptom is often confused with manifestations of diabetic neuropathy characterized by nerve damage caused by elevated blood sugar. People with diabetes who take metformin present an increased risk of developing B12 deficiency due to this medication's effect. Metformin can significantly reduce the absorption of vitamin B12 in the body, thus creating a vicious cycle of neurological complications difficult to distinguish. A B12 deficiency could therefore be misdiagnosed as peripheral neuropathy in diabetic people, leading to inappropriate treatments. This is why many experts recommend that people regularly taking metformin should be systematically screened for a possible vitamin B12 deficiency. Vitamin B12 deficiency is also associated with an increased risk of developing depression and other mood disorders that profoundly alter psychological well-being. Vitamin B12 represents an indispensable element for the development and maintenance of our central nervous system, on which our mental balance depends. Low levels of vitamin B12 can lead to an elevation in levels of a sulfur-containing amino acid called homocysteine in the bloodstream. High levels of homocysteine considerably increase oxidative stress in the body, responsible for DNA damage and cellular death with multiple consequences. Low or deficient levels of B12 can lead to other serious medical conditions, notably psychoses and various mood disorders requiring specialized care. Concentration difficulties and alteration of cognitive functions are among the most disabling neurological symptoms of B12 deficiency. This deficiency can cause significant concentration problems, particularly frequent among elderly people but potentially affecting all age groups. The good news is that mental disorders related to vitamin B12 are generally treatable with supplements administered at adequate doses under medical supervision. Gastrointestinal problems constitute another category of symptoms frequently reported by people suffering from vitamin B12 deficiency. A B12 deficiency can cause diarrhea, nausea, constipation, bloating, gas, and other uncomfortable gastrointestinal symptoms. These digestive problems can affect both adults and children, considerably disrupting their quality of life and general well-being. Frequent headaches represent another common symptom that people deficient in vitamin B12 regularly report to their doctors. In fact, headaches are among the most frequently reported symptoms linked to B12 deficiency in both adults and children, according to several scientific studies. People with high levels of vitamin B12 would have 80% less risk of suffering from migraines than those with a deficiency. Muscle cramps and weakness constitute frequent physical manifestations of vitamin B12 deficiency that limit mobility. B12 deficiency negatively affects motor and sensory nerve functions, which can cause painful cramps and disabling muscle weakness. Ataxia or coordination and balance disorders is a serious neurological symptom that can result from prolonged vitamin B12 deficiency. A person suffering from B12 deficiency can thus experience difficulties walking and maintaining balance, considerably increasing the risk of falls. Erectile dysfunction affects many men with vitamin B12 deficiency as a direct consequence of elevated homocysteine levels in their body. Visual disturbances are also part of the possible manifestations of B12 deficiency, probably due to lesions affecting the optic nerve and associated structures. These visual disturbances can range from simple blurriness to more severe disorders requiring rapid ophthalmological consultation to avoid permanent complications. Demyelination of peripheral nerves and spinal cord can occur in cases of severe vitamin B12 deficiency, causing various neurological symptoms. This deterioration of the myelin sheath that protects our nerve fibers compromises the transmission of electrical impulses in the nervous system. Skin color changes can also occur in some people with significant long-term vitamin B12 deficiency. A yellowish tint is often observed, particularly around mucous membranes like the mouth and eyes, indicating an underlying anemia. Heart palpitations and murmurs are common cardiovascular symptoms associated with anemia resulting from vitamin B12 deficiency. These cardiac manifestations occur because the heart attempts to compensate for the lack of tissue oxygenation by increasing its output and frequency. Unexplained weight loss can constitute an alarm signal of vitamin B12 deficiency, particularly when accompanied by other characteristic symptoms. This weight loss generally occurs due to decreased appetite and associated digestive problems that limit nutrient absorption. Mood swings and irritability are frequent psychological manifestations of B12 deficiency that significantly affect social relationships. These mood changes can be subtle at first but intensify progressively as the deficiency worsens and disrupts brain functioning. A weakened immune system is often the consequence of prolonged vitamin B12 deficiency, making the body more vulnerable to various infections. This immunosuppression results from a direct impact on the production and maturation of immune cells that require this vitamin for their optimal development. Sleep disorders like insomnia or non-restorative sleep can also be associated with vitamin B12 deficiency and worsen fatigue. These disruptions of the sleep-wake cycle are linked to the effects of deficiency on the central nervous system and neurotransmitter production regulating sleep. Restless leg syndrome, characterized by an irresistible need to move the legs, particularly at night, can be exacerbated by B12 deficiency. This uncomfortable neurological syndrome can significantly disrupt sleep and contribute to the general exhaustion felt by deficient individuals. Growth and development abnormalities in children can result from vitamin B12 deficiency, affecting their physical and cognitive potential. Young children suffering from this deficiency may present growth delays, learning difficulties, and impaired motor development. Thin and brittle hair as well as fragile nails constitute visible external signs of a possible vitamin B12 deficiency not to be neglected. These skin manifestations result from a disruption in cellular renewal that requires this vitamin for adequate synthesis of structural proteins. A dysfunctional peripheral nervous system can lead to increased pain sensitivity in people with vitamin B12 deficiency. This hyperalgesia is explained by alterations in pain transmission pathways and inhibition mechanisms normally regulated by vitamin B12. Slowed reaction speed and diminished reflexes constitute objective neurological signs that doctors can evaluate during a clinical examination. These neurological abnormalities testify to an alteration in nerve conduction resulting directly from deficiency in this essential vitamin. Unstable gait-OR balance disorders can occur in elderly people suffering from long-term vitamin B12 deficiency. These walking disorders considerably increase the risk of falls and fractures, particularly problematic in this vulnerable population. Memory problems and mild cognitive disorders are often confused with normal aging when they can signal B12 deficiency. These memory difficulties can sometimes be reversible with adequate vitamin B12 supplementation, emphasizing the importance of early diagnosis. Altered taste and loss of appetite are frequent symptoms that contribute to malnutrition and worsening of vitamin deficiency. These sensory disturbances are explained by the impact of deficiency on taste cells and nerve pathways involved in flavor perception. The identification and rapid correction of vitamin B12 deficiency are essential to prevent potentially irreversible neurological complications. Treatment generally relies on oral supplementation or injections depending on the severity of the deficiency and the underlying cause identified. A balanced diet including vitamin B12 sources like animal products remains fundamental for maintaining optimal levels. Vegetarians and vegans must particularly ensure they consume fortified foods or supplements to avoid this nutritional deficiency. Regular medical follow-up with blood tests allows monitoring treatment effectiveness and adjusting doses according to biological parameter evolution. Prevention of vitamin B12 deficiency involves increased awareness and early screening in identified at-risk populations. Understanding these warning signs empowers you to take control of your health and seek appropriate medical attention when needed. Remember that early detection and proper treatment can prevent serious complications and restore your vitality and well-being. Don't ignore these symptoms if you experience them persistently, as your body might be sending you crucial signals about your nutritional status. Take action today for a healthier tomorrow by staying informed about vitamin B12 deficiency and its impact on your overall health.